All right, so the final micro learning lecture for Module 1, Week 1, will be on simulation. Okay, so remember, in simulation lab, what we do is we review and practice and check off on nursing skills. We will complete simulations and we will complete concept maps. So the learning outcomes for simulation and lab is demonstrate written and verbal communication, teamwork, and collaboration, perform skills safely and accurately in simulated care settings, discuss delegation from the perspective of the registered nurse, discuss attributes, again, of professionalism. So the nursing skills to be reviewed and checked off. So we will have a simulated client, Emmett Watson. So we will administer medications. We'll talk about, the disease process. We'll talk about the nursing process. We'll talk about the clinical judgment model. And then what we're going to do is you guys are going to practice skills and check off on the skills as well. So we typically like to do peer-to-peer check off. So get with a partner and then you will practice the skills and then check off. Also, it's important to note that your head to toe assessment will be due by Sunday. So make sure you videotape that, or you can probably, if there's enough time, complete it on Tuesday evening as well. Okay, so we do have a Blackboard site that we have the skills, and then we have ATI as well, where you can log in and complete the videos and complete a pre-test, post-test, and then we will utilize EHR Tutor as well. So understand the RN guidelines on how to prioritize, delegate, and an assignment. So typically as a new RN, what do you anticipate the charge nurse to assign you, right? Is it going to be a patient that has an acute MI? Is it going to be a patient that just had hip surgery? Right, so kind of look into that and see what you will anticipate as a new graduate RN. We will use case studies in simulation as well. So just remember, we'll talk about different aspects of care, and we'll talk about labs, we'll talk about vital signs, we'll talk about different disease process, we'll talk about socioeconomic statuses, we'll talk about different aspects of the patient's health. So just remember, each week we will have patients in simulation. So this week we'll have Emmett Watson, and he will be an EHR tutor. So you'll practice barcode scanning, you'll practice administering IV push Lasix, and we'll talk about it, and then debrief, talk about the mistakes, talk about what went good, what went wrong, and then go from there. And then we have concept maps to complete as well. That way we can apply what we're learning. So each patient you care for will complete a short concept map. You will be using patient problems, not nursing diagnoses, and you will complete 2 to 3 nursing interventions for one of the 2 priority problems. And then after the weekly simulation, you will complete the evaluation based on the outcomes. Okay, and again, these are the learning outcomes. So make sure you dress in scrubs, make sure you bring your stethoscope, and then also bring your lab kits, right? With your syringes, with your Foley cath, because we'll be practicing a lot in lab. All right, so see you Tuesday. Email me if you have questions.